Hi, my name is Elizabeth Campbell, and I'm an occupational therapist in Waterloo, Iowa. Today I am meeting with you in my personal kitchen to engage viewers like you in an educational activity as part of my post-professional doctoral work. The idea for this presentation comes from my topic of addressing functional cognitive deficits after a stroke. I work in the acute care setting at a local hospital, and oftentimes we are asked by physicians if a patient can walk as the main component of determining a patient's discharge recommendation. So this is of great concern to me personally, as according to our American Occupational Therapy Association, AOTA, an occupational therapist's job is to ensure that a patient can safely navigate within their discharge environment. So this doesn't mean can they walk, right? There's a whole lot more to just being able to walk. So can a patient carry their young child on their hip while they're reaching above and below their waist to gather items to make dinner? Or what about a construction worker that wears a tool belt and has to climb a ladder and safely navigate and reach, and not to mention the hand and eye coordination to hammer and nail on that ladder, okay? So simply walking is an understatement as far as when it comes to discharge recommendations. Are patients able to manage their medications safely? Do they even understand their diagnoses? Did you even know that pharmacies can actually place medications in a pill box for your loved ones or for yourself, and insurance companies will pay for that? These are things that people just don't even realize are available to them. And another aspect, are patients with cognitive deficits, are they able to schedule appointments and figure out transportation getting to and from these appointments, right? So these are just a few examples of the activities of daily living or the instrumental activities of daily living, which we call ADLs and IADLs. These are occupations that you participate in from the moment that you wake up until the moment that you go to bed. They're the things that you do every day in life. And this is what OTs look at. So AOTA also tells us that rather than assessing a specific cognitive task or skill, like attention or memory or problem solving alone, functional cognition means we need to bring it all together. Right? The only way to do this is to identify a patient or a client's ability to perform the essential task itself. So this gives us a better look at the totality of the patient or client's ability to use strategies or habits, routines, even the resources that they seek out while they're doing these tasks. So functional cognition can only be adequately evaluated in the context of the patient or client participating in that actual occupational performance. So, in other words, let's see them do it, okay? Here's a short example. I had a patient at the hospital. I was evaluating them after a stroke. The conversation seemed normal. Family members didn't notice any changes in cognitive status. Communication was going very well. Physical therapy had already seen this patient and discharged them. So I'm coming in as an occupational therapist. I'm doing a walk and talk assessment. Everything seems to be checking out. So we get to the elevator, and all of a sudden I'm waiting, and they don't hit a button. So essentially we're standing there, and you might think, okay, well, yeah, here and there you get busy, you forget to hit the button of the elevator, that's fine. But we waited for 3 minutes before I finally prompted the patient, in which case they, oh, I forgot, okay. So we press the button. Then we get into the elevator and we wait again. And I'm thinking, okay, well, so the doors have closed and we're not moving, and the patient has not realized that nothing's happening, right? So this patient was having difficulty with problem solving and realizing that they needed to initiate pressing the button in order to get the response that they were looking for. So they required verbal cueing from myself in order to facilitate this. So let's fast forward to this patient going home, okay, because they're able to walk. So discharge recommendation says they're good to go home. Well, we're in their kitchen. Would they know to turn off the stove after they've used it? Would they know to take the plastic off of the frozen pizza before putting it in the oven? What about aluminum foil and putting that in the microwave? Would they know these things that we take for granted? So functional cognition is looking at the totality of the task and seeing if the patient is able to initiate and sequence and problem solve in order to get these things done that we would normally do and we just view as like an everyday task. And these things can be difficult after a stroke. And this also leads me to how looks can be deceiving and how occupational therapists, it's important for us to evaluate a patient's functional cognition by having the patient perform the actual task. So this is where we can get creative in a hospital setting. I've used wipes containers, I've placed them around hospital rooms, had patients reach up and down, challenging their dynamic balance. I've taken sticky notes and I put numbers and I have them reaching and doing one task while also doing the mental math on the sticky notes, just to challenge. Literally, the sky is the limit, but we have to do what we can. I've even taken, I think, a garbage can and flipped it over in order to simulate a tub transfer for a patient going home. So, back to my kitchen. I want to give you a tour. And the objectives of this activity are to identify 5 safety hazards or potentially hazardous areas, and to come up with ideas on how to avoid or minimize these concerns. And at the end, we'll go through together and I will talk briefly about some of the concerning areas, and I'll mention a few tips and tricks to facilitate safety and ease for those suffering with cognitive impairments, and also for the caregivers that are with these patients and clients. So let's go for a stroll, okay? So first we'll come over here and we'll see my ironing board. And while this is so nice and convenient for when something is special and you have to get ready, this is hot, this is top heavy, this is dangerous. Let's just hide that, okay? You use it, put it away. Moving on, excuse me. So I love having my candle here. I like to keep the lighter here nice and handy. Going around, I keep the checkbook where I know where it's at. Okay, and then we'll come over here to my refrigerator. I've got all the dates and all the invitations and everything that you can imagine that comes in the mail, easily accessible. On the side here, we've got all the schedules for everything going on during the week. This is kind of our, This is kind of our accessory area. This is where we charge our phones. This is where we charge our watches. This little guy is amazing. He runs around the floor and cleans. This thing does wonders. It's like a 9-in-1 ninja. Little bit of cans because we like to promote recycling. Bug spray because here's the door to go outside and you never know when you need it just to jump in the car. We'll come through this way. This is my oven here and stove top, and we'll have to watch out there. And so the dishes are drying. I like to keep the toaster here readily accessible. Multi-purpose. I use this cute little glass guy to put some dish soap in. It just looks nice. And then drying, we've got the cutting board, or the knife, what's this, the knife holder, knife block. I like to keep the knife sharpener out here in case we get ambitious. This is our smoothie maker. I think I use this thing almost every day. I make sure to keep the blade nice and clean, and we've got that plugged in and ready to go. Medications here, I keep the dogs as well as ours, just all in one place. Looks like we've got a little spill here. Oh, and don't mind the rug by the faucet, but I like to keep the dog's bowl just right here by the sink. It's easy access, so I can refill it because I feel like she drinks like a fish. So hopefully you were able to come up with 5 areas that are a little concerning, and we'll take a trip back around and let's go through some ideas to compensate and adapt in our kitchen. All right, so we talked about the ironing board and just eliminating that as a concern, because this is hot and someone with cognitive deficits might not know to pick it up just on one side, might accidentally, or if they bump it, it just is top heavy and unsafe for everyone, including children. Stools, you might have seen me bump into this guy. Let's keep those kind of in and tucked away. The lighter for easy access, going to the candle. While candles smell amazing, a patient with a cognitive deficit, I think it's safer at home if you go with a battery operated versus something like this, because you never know if they might forget to blow it out before they go to bed at night. And leaving lighters out, I just feel like it's a temptation that could just be easily avoided, and so opt for the battery option. As far as checkbooks, this is something that is of concern because sometimes people come to your house and they might be asking for a little bit of money, or even, we get phone calls of ads, people asking for money. And if you're gone at the grocery store, or someone is left alone at home and has a cognitive deficit after a stroke, this is out and available and can sometimes be easily manipulated. So keep the checkbooks away, and make sure that you go through things like, what if someone calls and asks you for money, what would you do? Because that can be an area that they can easily be taken advantage of. As far as the refrigerator, this, while all fine and dandy, it's cluttered, it's a lot, and it's very overwhelming if you have a cognitive deficit. It's hard to kind of decipher. So keeping this all clean and neat and tidy, even if you put a calendar up here with maybe just simple to-do list with a few things when you're gone and they've got extra time, here's the honey-do list, right? Okay, heading over here to our appliance counter. Here's another cluttered area. If you can get rid of, here's one thing that we've actually done at our house, which is really nice to eliminate clutter, is I took 3 cords that we had for 3 different electronic items, and I braided them together just to simplify, and then I color coded so we know how to plug them in. So getting rid of excess cords, or at least trying to minimize the clutter, is ideal. Get rid of the lighters, or at least put those in a safe area. Also, another thing I want to mention is keys. So some patients that have cognitive deficits, if they're not quite aware of those deficits, they might be apt to grabbing the keys and going for a stroll, as they maybe did previous to their stroke. So getting the keys, putting them somewhere safe, is honestly out of sight, out of mind, right? So let's eliminate the temptation. You saw me bump into the knife, and it may seem like an obvious thing, but let's just put the knives away. And the cutting board, I will put this back in that, and I might even hide the cutting board, because just having knives open and setting there can be a little bit of a hazard. Also, if you have a cognitive deficit, it's not recommended that you drink, because this can cause impulsivity. It can even heighten the impulsivity that might already exist with a cognitive deficit. It also causes balance concerns, and there's just numerous things, and it's not good to be drinking after there are cognitive impairments. So, bug spray, something simple, but yet I leave it here by the door. It's probably not smart. If your loved one or client or patient is using the oven and cooking, who knows if they were to accidentally grab this and maybe use it as a Pam spray for their meal. So keeping that out of the way. I also, if you caught this, wouldn't leave a rag on a burner. One really neat tip or trick is the little circular stickers that you use in garage sales to like tag things. You could use those on the oven or on the microwave, like a green one for go, right? So bake, if that's what they do most often. Put a green sticker on the bake and then put a red one on like the stop, okay? So, or the off button. And that's a nice way to, as a reminder, it's a visual cue to remind them. Pots, always make sure that the handle, it goes on the inside, so that way it's not a hazard when you're walking by and you accidentally bump it. So, dishwasher, it's not ideal, the situation, the small quarters, so we'll just keep that in and kind of tucked away. Stove, toaster shouldn't necessarily be next to the sink. The glassware, I should probably practice what I preach. This is not probably smart, and to be honest with you, I've actually broken one with it falling straight into the sink. So, same with this. We talked about the knife block board. The sharpener, let's probably eliminate that. Not a good idea with them being out, and this could be a memory jogger for where are the knives at, right? Never, ever, ever, I'm on my parents about this all the time. Don't leave this plugged in when you have this in here, like at least turn it so it's not going to be an accidental woo. Medications, the pills all together in one spot, that's great, but the dogs and the humans' pills, let's keep those separate. And if you have questions, reach out to your pharmacy, because insurances will pay for the pharmacy to set up pills for your loved ones to make sure that they're taken correctly. Tripping hazards, make sure that you remove all of the freestanding rugs. We talked about clutter earlier. The water, let's keep that clean. Dog bowl, that's a tripping hazard. Let's get it out of the way. Well, I'm glad that you were able to join with me to clean up and make sure that my kitchen was extra safe. And I hope that you were able to gauge and learn a little bit about exactly what it is that occupational therapists can do for you. If you have questions or concerns, reach out to your primary care physician. They can actually put in an order for an occupational therapist, a referral to your home, and we can do a home safety evaluation. So have a wonderful and safe rest of the day. Thank you.